Hello, everybody. My name is Sikander Ailawadhi, and I'm one of the hematologist-oncologists at the Mayo Clinic in Jacksonville, Florida. And I'll be talking to you about one of our studies that was presented at the American Society of Clinical Oncology annual meeting, which was a virtual meeting this year. And this study was about the impact of the combination of lenalidomide, bortezomib, and dexamethasone, also called as RVD induction, on patients with newly diagnosed multiple myeloma with some kidney dysfunction. And this data is from the National Connect Multiple Myeloma Registry, which is a registry database looking at multiple myeloma patients, just how they are treated in real world, and then following along. So the importance of this study was that we know that a significant amount of, or a significant number of patients with multiple myeloma, even at the time of their initial diagnosis, can present with some degree of kidney dysfunction. In fact, kidney dysfunction is noted as one of the myeloma defining criteria, so that sometimes patients can be diagnosed just because they had the kidney dysfunction to start with. We also know that some of the medications, especially I would say the family of the drugs like lenalidomide, can be removed from the body by the kidneys. So it's possible that if a patient comes in with a lot of kidney dysfunction, they may not automatically be started on a lenalidomide-based regimen. And the thought may be that the patient should start on something else, hoping that the kidney function improves. Another important thing to keep in mind is that in multiple myeloma patients, if they present with kidney dysfunction, but if within the first 2 to 3 months, the treatment is able to reverse that kidney dysfunction, then the patient's outcomes and prognosis is much better. So what that means is that it is extremely important for kidney dysfunction to be appropriately treated and the myeloma to be treated well so that the patient's kidney can improve, and that improvement can affect the patient's long-term outcome, even survival. So with that in mind, we did an analysis from the Connect Multiple Myeloma Registry, which is a large community-based registry, primarily with patients from the real-world community settings in the US. It is multi-center. It is an observational study in which the data is collected from those patients, but their treatment is whatever their doctors think should be given. And patients with newly diagnosed myeloma are registered, and real-world patterns on the diagnosis of myeloma, treatment patterns, outcomes, and quality of life questions is collected. So the objective of this particular study was to investigate the impact of lenalidomide, bortezomib, dexamethasone, which is also RVD induction, on renal function in transplant eligible and also transplant ineligible patients in the real world setting. So patients in this registry, patients who are adults above the age of 18 with newly diagnosed myeloma, within 2 months of starting the treatment, their data, they are put onto the registry and just data is collected. So a total of more than 3,000 patients have been enrolled, and patients out of those nearly 3,000, about 2,943 patients started some kind of treatment. Again, the treatment was decided based on whatever their physician thought, and then the patients were followed up until they either discontinued and just got off the registry, or whenever the study ends. But it is expected that this registry will continue till probably 2024. So for this particular analysis, changes in kidney function with the treatment were assessed in patients, and the patients were grouped according to transplant eligibility and also according to their kidney function categories. We noted in this analysis that whenever patients were given this induction treatment with lenalidomide, bortezomib, and dex, or RVD, they had a significant improvement in their kidney function, whether they had mild, moderate, or severe kidney dysfunction to start with. And we noted this in both transplant eligible and transplant ineligible patients. We also did some analysis about using cutoffs of whether the patients got that improvement early on, that is within 3 months of their treatment, or later on. But the bottom line was that all categories of kidney dysfunction patients had a significant improvement when they got treatment with this RVD induction. Then on top of that, we also wanted to see, did their survival probability change if they had poor kidney function or good kidney function, and when they were treated with this RVD regimen. And what we noticed was that there was no significant difference, meaning that while we know that patients who have kidney dysfunction have worse survival or outcome, when patients with varying degree of kidney dysfunction were treated with RVD, not only did their kidney function improve, but also that kidney function was no longer associated with poor outcomes. So what this study explains is that we know kidney function recovery is extremely important in myeloma. But when patients are appropriately treated with this 3-drug regimen of VRD, which is one of the most standard regimens used in myeloma treatment today, the patient's kidney function not only improves, but kidney function related poor survival is no longer an issue. So of course, this is not supposed to be a clinical trial looking at this specifically, but I think it generates a lot of important real-world information which we can utilize for our patient care across the country and in fact across the world.